With that, I'm going to go ahead and turn it over to Dr. Madigan.
Hey, thank you for that introduction. And I kind of consider myself more of a Chagas lifelong student than a guru. Always learning. So I think that's really the key to everything. But I wanted to thank you guys for having me out tonight. And I'm really passionate about this subject. And hopefully you guys are going to get some good information about this. I'm going to give you a brief overview of what the heck Chagas is, how it's transmitted, why it's important, why we need to even be talking about it tonight, and why you as pet owners and breeders and active dog lovers in the community need to know about this, okay? And hopefully give you some encouragement and also empower you a little bit to do some things in your community to help raise awareness and kind of help prevent the spread of the disease. So a little brief background about me. I'm a small animal veterinarian just north of San Antonio, so a couple hours north of you guys. And I've been a veterinarian for about 22 years, and Chagas disease picked me. I didn't pick it. In fact, in vet school, I slept through this lecture because I thought it was so irrelevant. But life has an interesting way of correcting you and putting you on your path. And this disease definitely found us where we are. And I wasn't really content to just accept the status quo out there and watch all these dogs die that had this disease. So we started studying it about 19 years ago. And we've developed a treatment, a diagnostic, and we're pushing through FDA right now to get it approved so we can get some treatment out to you guys and your pets. So that's pretty much it. I'll get started. You guys enjoy your meal. I'm going to talk for about 45 minutes, and then we'll have a question and answer. I'll stick around as long as you'll have me, and we can kind of do an acoustic version of things and field your questions and things like that. So without further ado, we'll get started with some things. So Chagas disease is a parasitic infection, very similar to heartworm disease and Lyme disease and Ehrlichia and Anaplasma, all these other what we consider vector-borne diseases. So these parasites need and require a host, okay? And that's where the vector comes in. And the vector is usually an insect. So for instance, with heartworm disease, you guys are aware that the vector is the mosquito, right? So with Chagas disease, the parasite's called Trypanosoma cruzi, and it's a microscopic parasite that loves to live in kissing bugs. So if you guys don't know what a kissing bug is, it's I'll have some pictures here in a minute. It's a pretty big bug, okay? It's the size of a quarter, and they fly, they crawl, but at the end of the day, they're just looking for blood. So they hone in on CO2. So any mammal produces CO2, right? So a dog is in this picture, but a dog is just as tasty as a human, as a frog, okay? So they're going to be going after things that breathe and sucking blood and transmitting that way. So the classic transmission rate for these guys in the life cycle is that one of these kissing bugs takes a blood meal and defecates, okay? You can't make this stuff up, how parasites are transmitted. It's crazy. But in that defecation, the parasites live, okay? And then the parasites work their way into the wound. Either the patient scratches it, when they're sleeping. Real common way that people get it is they get bit in the face because they're breathing, right? And they scratch in the middle of the night and they rub it into their wound. And then the parasite gains access to the bloodstream that way. So it goes down here from this brown, gross poop here in the skin, hops into the bloodstream, and hijacks the immune system, okay? So it literally hops into that, goes to the lymph nodes, spreads to all the tissues, and eventually makes it to key organs, okay? One of those key organs is the heart, but please remember that the parasite's in every single tissue, okay? It's not just the heart, but it has an affinity for it, so we kind of pick on it. So once it's in the heart, it changes, okay? It goes from this infective phase, these little babies, into a tissue phase. We call that the amastigotes. You can see this little bitty sliver of T. cruzi right here penetrating into one of these cardiomyocytes, so one of these cells. And once it's in there, it goes into this stage where it's replicating, okay, called the amastigote stage. Just like a virus, once it replicates enough, it bursts that cell. And you can see it here in figure D. These little babies come shooting out, okay? And then they hop into the bloodstream, complete the life cycle for another kissing bug to take a blood meal and suck up T. cruzi that way and continue the cycle, go bite another dog. A couple important things about the slide is this is, number one, this is the classical transmission, okay? Other modes of transmission are important. In fact, oral transmission, which we'll talk about in a minute, is even more common in dogs. Makes sense, right? They're always eating everything. And what's to stop them from eating a kissing bug that just took a blood meal and tastes all chewy and squishy on the inside with blood, right? So that's a real important differentiation between dogs and people on how they get it, which explains why we see so much more Chagas in dogs than we do in humans in America. So oral transmission. We also have what we call vertical transmission, which is from the mom, the bitch, to the babies. Okay. We also have ingestion of what we call carrion, so basically dead things. So, for instance, eating armadillo or possum or whatever wildlife that is infected with Chagas today, they're going to ingest it that way through eating that raw meat, that blood. Okay, blood transfusion is another way, probably a little bit more common in humans. Obviously we do blood transfusions in veterinary medicine, but not near as frequent as they do in humans. So those are just some, pretty common methods. Okay, they could also ingest it outside of the kissing bug. So if they just lick excrement, on the ground or something like that, or on a stick when they're chewing on it. So those are kind of some important things there. Okay, this is what they look like. Okay, we've got the three most common in Texas, and then this short little squatty thing is a nymph. Okay, so it's a baby, and you can see they're about half the size. Okay, but you can have any of these life stages. Any of them can carry Chagas. There's 7 different species found in Texas, but again, these are the 3 most common that we see. They're more active in the summer months. Whatever. Do we even have seasons here in Texas, especially you guys down there? I mean, it's like hot and hotter, right? These kissing bugs are year round, okay, and we find it all over the place. Now, maybe in the panhandle where it's freezing and things, more commonly, maybe they truly have a season, but from what I've experienced, they're everywhere all year round, just like mosquitoes. It's interesting because over 60% of these kissing bugs in Texas carry the parasite. So, you've got a 2 out of 3 shot that if you see your dog getting bit by one or eating one of these bugs, it's probably going to get it. Okay. Interestingly, those are the same numbers that we see in kissing bugs in Mexico City. So we're not different from Mexico as far as prevalence of Chagas disease. These things eat everything. Okay, they eat blood from anything like we were talking about. Possum, squirrel, deer, you name it. They're on the list of things to chew on. Okay. Oral transmission. I have this slide in here just because it's so important. I mean, how many of your dogs have pulled up a dead armadillo? I mean, our GSP has killed multiple ones of these, which is probably how we got it, how we got Chagas disease. We also have even cats, stalking. This is a bug right here on the right side. So we have a lot of oral opportunities, a lot of shots on goal for dogs to consume kissing bugs and, more importantly, T. cruzi for Chagas disease. Why is that important? Well, when a dog eats kissing bug with direct oral transmission of a bug parasite, other than getting bit and it going through the skin and kind of getting diluted out, it's really, really important because clinically, when a dog ingests, or a human for that matter, ingests T. cruzi or Chagas, it's much, much worse. The clinical presentation is bad. Okay. Mortality rates are through the roof on humans when they consume them on accident. And the reason is because when they ingest orally, when they ingest the parasite orally, the average load is 600,000 parasites if they eat a whole kissing bug, compared to 50,000 if the kissing bug just defecates in the wound. So that's important. Okay. Our dogs are definitely more exposed, but it's not just because they're outside and eating stuff. It's because they're eating the kissing bugs and getting it that route. Okay. So very, very important. 3 times or 300% increase in mortality rate in humans if they orally ingest it as compared to getting bit by the kissing bug. This is from South Texas, kind of close to you guys. I had a client send me a picture of this real nice 1970s China and about 60 of these kissing bugs. This was found one evening on her back porch, just FYI. Pretty gross. So where do kissing bugs live? This map's from the CDC. And everywhere in orange, including Hawaii, there's kissing bugs that have been reported. Okay. It doesn't mean that all these white states don't have Chagas disease. It just means that they don't have transmission there. Okay. As you guys know, with rescue organizations, travel for your shows and things like that, or if you're selling puppies up north, I mean, there's potential for transmission up to those northern states. And we've gotten phone calls from all these states in the white with veterinarians going, what is going on here? I have a 3-year-old dog with heart failure. So just because you don't live in a state doesn't mean you won't see it. Okay. But these kissing bugs truly are in the lower 26 states and very high prevalence. Just to put things in perspective and context, what I did on this slide was these 5 states we actually have published data on. We're actually looking at 8 other states that we're going to be doing a paper on prevalence rates, just because nobody's looked at it yet. But for purposes of this talk, what I did was I put heartworm disease prevalence in red. Okay, so start with Louisiana. They're the #1 state for heartworm disease. 7.1% of the dogs in Louisiana have heartworm disease. Okay, and then you look at the data on Chagas, 22%. Okay, and you can see this: Tennessee 2.76.4, Texas 3.3, 8% is with the military. We're going to bump it up to at least 18%. Okay, Oklahoma, again, small population here, pretty close to heartworm. California, look at that, 0.42%, about 0.5% have heartworm disease. 15 to 60%, depending on which county you're in. And we just got our data in from San Diego, and they had a 32% prevalence rate in those dogs down there in the South. So, when we all are trained as veterinarians to preach to you guys about heartworm disease, and it's important, and it's preventable, and it's treatable, but we're missing the elephant in the room. Okay, we've got a lot of Chagas disease compared to heartworm disease. So, and again, you guys probably work with all kind of different dogs. A&M put this paper out a couple years ago, and they looked at breed predisposition, and kind of surprising. I mean, bulldogs really aren't #1 for anything other than veterinary visits, but they came in #1. So about half the dogs that cardiology service saw at A&M tested positive for Chagas disease. And then on down, German Shepherds, 1 out of 3, and then Chihuahuas. And I think that's because I don't think that many people really have Chihuahuas. I think it's because San Antonio sends them a lot of dogs, and they just happen to be Chihuahuas. But the overall prevalence rate in companion-owned dogs in Texas was 16.8% based on A&M's data. It's a lot of dogs. It's a lot of Chagas positive dogs. Kind of another interesting thing about this paper was, what drove the clients or the owners to the veterinarian to get tested for Chagas. A lot of them had to do with an arrhythmia. So, for instance, if we're doing a procedure on your dog and we find that we've got, we're doing a dental cleaning, let's say, and we're sedated, we're watching that EKG, and we see an arrhythmia, that would prompt us to do a test for Chagas disease. Okay. The other one would be in the exam room. We're listening, we're sculpting with our stethoscope. We're like, hey, we're having some drop pulses here. We might want to do a Chagas test. Okay. So that was #1. And #2 would be, well, his sister tested positive for Chagas. I'm going to go ahead and test this dog in my pack. And that's something, and we'll talk about that in a little bit, but we definitely recommend that you guys test all dogs in your pack if you have one, really all animals. So that would include, cats and other dogs, and also horses in that equation. You have testing chickens, they're not going to get disease. So what does Chagas disease do? Why do we care about it? Okay, why do we get so worried about Chagas when your dog has it? Chagas disease, like I said earlier, goes to every tissue, but for purposes of this, we'll kind of focus in on the heart because any amount of damage in the heart can be fatal. So Chagas disease, similarly to heartworm disease, it's a progressive disease, okay? And it causes fibrosis, just like heartworm disease. But Chagas disease causes fibrosis or scar tissue buildup in the heart muscle itself. So heartworm disease causes fibrosis in the artery that goes to the lungs, makes it real stiff and starts to distend it, and that's not good. But it takes a long time and a lot of heartworms to do that. Chagas disease can be very rapid. And so what happens is over time, one of the things that we see with Chagas is that this fibrosis or scar tissue buildup leads to heart failure. Okay, so that's #1. And that's what here, biventricular or bilateral ventricular failure and dysfunction. Basically, the heart gets stiff and non-functional and the pump goes out. Okay, heart failure. But the biggest thing that it does, about 98% of dogs have this phenomenon, is it causes arrhythmias. Okay, and that's an arrhythmia. All it is an abnormal heart rate or rhythm. And the electrical system itself, so we're not talking about the muscle of the heart, we're talking about the electrical system. So that plumbing that's in there that makes the heart beat and makes it stay on target with a good cadence and makes it speed up appropriately and slow down appropriately, that thing gets messed up. Okay, that's what we see most commonly. That's why we run EKGs. That's why we really focus in on that electrical. And that's why we can have a dog that has a normal x-ray on its chest or a normal echocardiogram with the ultrasound, and we can still have serious disease, or that dog can still die. Okay, so that's really important, those arrhythmias. And then the last thing that we see, and this has to do with this fibrosis or scar tissue buildup, is that we see extensive cardiac ventricular remodeling. Basically, what that means in English is the heart gets bigger, okay? Despite a normal functioning heart, it'll still distend and get weird and look funny on our X-ray or echo. So here's some pictures, and again, I hope you're not eating right now, but I don't mean to gross you out. But we'll start with this one in the middle here. This is a classic, this is a bulldog, big surprise, right? Classic young dog, about a year old, that had Chagas disease and right-sided heart failure. And this is, she didn't make it. This is her heart right here. And this is the right side, really dilated and floppy and non-functional. Okay, what happens when the right side of the heart fails is it starts to back up, and you'll get this amazing amount of fluid. So this owner's like, I think she's pregnant, and obviously she's had a couple heat cycles, but he's like, I think she might be pregnant. Put the ultrasound probe on there, full of fluid, about 8 pounds of fluid. We call that ascites. This dog too, different dog right here, same deal, big pot belly here, right-sided heart failure, Chagas disease, okay. But from this heart, I want you to notice, one, it's big, it's dilated, but it's also real purple, and you can see all this white splotchiness everywhere. Those are all areas of inflammation that the Chagas has done, okay. Any amount of inflammation in the heart's not good. We call that myocarditis. So to go deeper, so we take our microscope and we look in, okay? This helps you kind of understand the different phases of Chagas disease. There's 2 distinct phases when they get infected. One's called the acute phase. That's within the first 8 weeks. They get exposed, and depending on a lot of factors, they can either die from it or they have a full recovery. Well, full recovery meaning it goes to the chronic phase. And then we have the chronic phase, which is after 8 weeks, and that's what most dogs we see. Like 99% of dogs we're going to see in that phase, okay? So this on the left is heart tissue. This is normal heart tissue, okay? It's beautiful. It's got these little purple circles in the middle. That's the nuclei, and then the cytoplasm, which is the pink part. That's the muscle. So all these cells come together. They're reasonably aligned in a very particular pattern so the heart can function and beat normally and efficiently. This on the right, though, shows a very irregular pattern. There's a lot of purple dots in there, okay? Those purple dots are inflammatory cells, okay? That's not good. There's a lot of still healthy tissue in here, but there's a lot of inflammation in this dog. Clearly, it didn't make it right. That's why it made it on the slide. But this inflammation kills dogs, kills people too. Myocarditis, bad stuff. Okay, now contrast that with the chronic phase. This is the chronic phase right here. Notice we really don't see, I know it's zoomed out a little bit, but we really don't see that much purple in there. What do we see instead? See a lot of white, okay? White is fat and fibrosis, scar tissue, okay? If you just kind of eyeball this and go, how much pink to white do I have? It's about 50-50, maybe a little bit less pink than white, okay? But about 50-50. This dog had half of its heart replaced by fibrosis and fat tissue, okay? This is what Chagas does over time. It pops those cells like we saw on that first slide. It kills that cell and it replaces it with scar tissue. This is one of the major reasons we treat Chagas disease, okay? This white tissue is non-functional, okay? If we get enough of this, we go into heart failure, okay? And you can imagine trying to run an electrical current through this, it's not going to work really well, which is why we have a ton of arrhythmias with these dogs. All right, this is another gross picture. This is a Great Dane. This is the liver. Okay, this is the heart, this is the liver again. And again, not to gross you out, I don't know how close the TV is to you, but there's a lot of junk in here, okay? This liver weighed 18 pounds, okay? It was so jam-packed full of fluid because the right side of the heart was really dilated. So you can see all this white in here, it's real scarred and really big dilated ventricle, okay? That's because this dog was only 12 months old. This dog had chronic Chagas disease at a year old, okay? Totally obliterated its right side and just packed up full of this liver, okay? And, you know, you can't live that way. You got to have a heart that's functioning. All right, so this is probably the most important slide. And for the veterinarians in the audience, I can talk to you guys for a minute. This is why we treat, okay? So I showed you the slide earlier. You know, we have a lot of scar tissue. We don't want our dog's heart to do that, right? So that's number one. This is reason number two, but probably the most important reason. The mortality rate, so the percentage of those dogs that die with Chagas range from 25 to 42% over a 2-year window. That's freaking high. That's a super high mortality rate. So why have vets asked me very frequently, I don't know who to treat. I have a dog that's asymptomatic, doesn't have any symptoms, can't find anything. Do I need to treat this dog? I just refer to this slide. Okay. That's a high mortality rate. And these are not dogs that are symptomatic necessarily. Some of them are at the time they come into the vet, but most of them are asymptomatic and they still have a very high heart rate. Okay. It's higher mortality rate than in humans. Okay. In humans, just if you're interested, 20 to 30% of humans with Chagas disease will develop heart disease. What they don't tell you about those numbers is half of those guys die suddenly. They have a sudden cardiac event. Okay. If they go to bed, they don't wake up. Okay. They go for a run, they don't come back. Very, very serious. Okay. The dogs are even higher than that. And this is just looking at the heart. Okay. This isn't looking at other tissue systems. So very high mortality rate. This is why we treat. And the most important thing about that is that we haven't figured out a way to predict which dogs are going to be in this category of dying versus living. Nobody's been able to figure that out. They can't even figure it out in human medicine either, how to predict how they're going to go. But this is why we treat. Okay. So how are we going to diagnose Chagas disease in dogs? Okay. We alluded earlier to the amount of arrhythmias that these dogs have. Okay. Tons of arrhythmias. So that's probably a good way that's going to kind of drive us to diagnosing or at least running the test for Chagas disease. So EKGs, there's a variety, a huge range of arrhythmias. If you can think about it, they can have it. It happens because the antibodies that the dog makes against the parasite actually will stick to the receptors on the heart and drive it nuts and make it arrhythmia. So the very mechanism that the body's trying to fight off the parasite is the same, one of the same mechanisms that it can kill itself with, or at least cause major problems with arrhythmias. Okay. This is because these arrhythmias, in addition to these autoantibodies that stick to the heart cells, it also, Chagas also knocks out that neurological perfusion or innervation, we call it, where everything's plugged in to the pacemaker in the heart. It actually knocks out those cells. Okay. It has an affinity for that. So it specifically destroys those areas, which cause problems. Okay. Holter monitors are another real common way. If we have a dog that's fainting, for instance, we put a Holter monitor on, which is just a 24-hour EKG. We have a picture of it in a little bit. Those dogs, we may get a host of arrhythmias that are going to be like, hey, I need to go ahead and screen this dog. Okay. The other way is diagnostic imaging. So radiographs and echoes, heart ultrasound. Your dog's coughing, or maybe it has a hurt back or a hurt leg, and we shoot a film and we're like, oh my God, this heart big. This is a big dilated heart, by the way. We're going to go ahead and think about Chagas disease if we see that, or if we're doing an echocardiogram, we see poor function, or we see a big dilated chamber, we're going to be thinking about that. Okay. The other way is pathology. I'd probably say at least a third of our cases that we diagnose with Chagas disease, we diagnose through pathology. And what I mean by that is we're doing routine blood work, just a wellness screen, which is a huge argument for you guys once a year to do some wellness blood work. So don't just focus on the heartworm or the fecal parasite exam, which are important, but go ahead and look at the kidney and liver and a CBC, which is going to give us a complete blood cell count. We see a lot of elevations in that, a lot of elevations, inflammatory markers that key us in on, hey, we need to check for Chagas disease. Okay. Sometimes we have a dog with a big lymph node, we aspirate it, we get something like this on the bottom right. This is actually a white blood cell, and inside of those little babies that we were talking about, those are mastigotes. To the left, you can see these are red blood cells, and then there's a little trypomastigote, which is one of the babies that's been released from the tissue that's going to be sucked up by the next kissing bug and kind of complete the life cycle. And if it doesn't get sucked up, guess what that little baby's going to do? It's going to find another cell and it's going to worm its way in and colonize it and then destroy it. Unfortunately, we diagnose some dogs on necropsy. So, like an autopsy. So they've passed away suddenly. Sudden death syndrome is very common in dogs with Chagas. We do a post, we look in there, we see, and we're like, oh, shoot. We had to do one on Friday on a dog that had really, really bad brain disease. We tried to keep him going for the rest of the week, and he just continued to decline, and he's got Chagas in his brain. And that just happened literally Friday. So his test came back today. But the gold standard for testing and diagnosis of Chagas disease is serology. Serology is specifically testing for antibodies or the body's immune response to a parasite or virus or bacteria or an infection. So what we're doing is we're sampling these dogs by drawing a blood sample. We send it to our lab, and they're going to check and see what antibody levels they are. Okay, so that's all that means. But this is the gold standard. So if you ask me, I don't know if I had my dog has Chagas, we're going to go ahead and do serology. Okay, there's two different methods. There's an IFA and an ELISA. It's not really important to you guys, more important to us veterinarians. The IFA is a platform that's been around since the 50s, very old technology. It used to be our workhorse. Unfortunately, the sensitivity is pretty crappy. Okay, it's 34%, which means 1 out of 3 dogs with Chagas, I'm going to be able to find it. Okay, but 2 out of 3, I'm going to miss it. All right, that's run at our state lab at Texas A&M. ELISA is the newer technology, 1980s. It's not like that new, but in veterinary medicine, it's newer. That bumps up that sensitivity about 90%. So it still misses 1 out of 10, but no false positives, which is huge. We like that. We don't want to chase a disease and say your dog has it, but we were wrong. It was something else. Okay. We also have PCR, which is DNA amplification. So we're looking for the parasite itself. We don't use it too often unless we have an acute Chagas case. But we also use it frequently to follow up with our treatment to make sure that we've cleared the organism at the end of treatment. EKG, if you guys haven't known by now, if by talking so far the past 20 minutes, I really like EKGs. They're very, very important and critical. Like I said earlier, about 98% of dogs with Chagas disease have arrhythmias. These are just kind of some common ones that we see. This is a picture of a dog. Very fitting that it's Adobe, right? Because these guys are always getting Holters because of genetic issues. But this is the new Holter monitors. Okay, this is what we use. They are tiny. They're the size of a candy bar. They used to, when I was in vet school, they had giant Holter monitors with wires going everywhere. And, we had a battery pack. We would put them in a vest and all kinds of crazy things. So those guys definitely are much more technologically advanced now. We can get a Holter and upload it within 24 hours and get a report back in a couple of days. So the other is, cats. Cats get Chagas disease too. This just reminds me to tell you that. And they have abnormalities too. We do EKGs on these guys. Kind of hard to get a Holter on a cat, right? But we can definitely do that. This is an arrhythmia right here. This is what we call VTAC. This is a fatal arrhythmia, bad. Okay. And you can see this particular dog was having runs, a couple normal beats, abnormal beat, back to normal. They can go in and out of VTAC throughout the day and night, and you would never even know. Okay. But it is a fatal arrhythmia, bad stuff. The other thing is too, during treatment, all these arrhythmias resolve. Okay. They're gonna get better with time. There probably is one exception to that with a bundle branch block. It's not that important, but it just signifies, hey man, we've got some pretty bad tissue damage here. We're going to have some permanent damage, but it's not going to impact these dogs' lives. So worst case scenario, you're going to be able to reverse these arrhythmias. Okay. All right. So let's talk about treatment real quick. This is the part where I try to encourage you. So I told you all the bad news. I'm going to tell you the good news. Good news is we do have a treatment that works. Okay. Like I mentioned earlier, we are visiting with FDA, and we're going through the process right now of getting it approved. It's a very tedious process, anything government, right? But we do use a combination therapy, okay? We're using 2 different drugs, amiodarone and itraconazole. Now, these drugs you may not have heard of before, but some of you who have AFib, you've definitely heard of this drug before. Amiodarone is an antiarrhythmic, okay? It's used extensively on the human side. We use it a little bit on the veterinary side, no particular reason. The cardiologist just chose a different drug over this one back in the day for whatever reason. Amiodarone was a more effective antiarrhythmic than the one that we currently use now, Solol, on a daily basis. But amiodarone in the context of Chagas is profound. Okay, it kills the organism, it blocks and prevents against arrhythmias. And it really does a nice job of really normalizing everything so the dogs don't die. Okay. The other drug is itraconazole. This is one that we use very commonly as an antifungal. So veterinary medicine is much more adjusted to and familiar with itraconazole. We're using it for the same reasons that a fungus dies, the same reason T. cruzi or Chagas dies. Okay. These are both once a day oral medications. Okay. We give it with the meal, and treatment, unfortunately, don't be angry, please. It's for 12 months. Okay. And there's some reasons for that, but we have to go a long time. This parasite is extremely resilient, and we have to get it out of tissue. Okay. And it takes time, because as soon as we hit it, with any drug that is somewhat effective, especially very effective drugs like this, it's going to slow its metabolism down and it's going to go into a near dormant phase. So we have to wait it out and rob it of all its supplies and necessities, and then we have to outlast it. Okay, so that's essentially why, in so many reasons. These drugs are very safe. However, 1 out of 5 dogs will have a decrease in their appetite, and 1 out of 6 dogs will have an increase in their liver enzymes. All these are dose dependent. So what does that mean? Well, FDA considers them mild side effects because we just lower the dose and the side effects go away. Now, there are some exceptions. I can count on one hand how many dogs cannot tolerate one of these drugs at all. They can't even look at it. As soon as it hits the stomach, they puke it up. Okay. And that's literally about 3 or 4 dogs that I've had in almost 20 years of doing this. It's very, very rare. The majority is just, hey, the drug's a little too hot for me. I'm going to have to dial it down a little bit. Okay. Environmental control, this is definitely a part of our treatment plan when you guys have Chagas disease, okay? We're not going to just treat the patient. We're also going to treat the environment so we can kill these bugs and hopefully prevent reinfections later on down the line, okay? So the biggest thing to do is to kill the kissing bug. Okay, how do we do that? Well, we use sprays, okay? Permethrins, not something, rare or weird. We've been using permethrins forever to kill fleas and ticks and, scorpions where we are and things like that. So permethrins are kind of widely accepted as the best for killing kissing bugs. This one right here, cypermethrin, is the one of choice that the WHO and the PAHO recommends. You can buy it at like Tractor Supply. You can buy it at Home Depot. It's under the trade name Home Defense, and there's also one called Demon, like Angels and Demons. So Demon spray. You can buy the concentrate and lock and load yourself. I recommend treating wherever the dogs go. Now, if you have 2 acres or 3 acres or 5 or 10, you don't want to be spraying everything. Okay, just hit the porches, hit the thresholds, hit your kennels. If your dogs are in kennels, take them out, let it dry, and then let them back out. Okay, but you need to hit those areas, especially where there's food, water bowls, things where wildlife are coming up and they're perhaps drinking in the middle of the night, or heaven forbid you leave food out, which I don't recommend, but where wildlife is coming in, because those kissing bugs are going to be there too. Okay, or where dogs like to sleep all day. Kissing bugs figure it out pretty quick where to hang out to get a blood meal. Okay. The other thing is systemic control. So using things that we use for fleas and ticks right now, they also kill kissing bugs, which is nice. Now, it does require for that kissing bug to take a blood meal, but it's going to get exposed to the drug and it's going to die and it's going to interrupt that cycle, right? So it's not going to go off and have babies and continue to perpetuate that cycle. Okay, so I still think this is really important. Bravecto, NexGard, Simparica, Credelio, there's all these, this is a whole class of drugs that we as veterinarians like. It's really helpful to use that. So environmental control, spraying the environment, treating with something to kill the kissing bug. Those are really important things. Another important distinction is this, Bravecto, NexGard, it does not kill Chagas. It kills the kissing bug, so the vector. Okay, so want to be clear on that. All right, so now we'll spend the last 10, 15 minutes talking about some case studies just to help you guys, wrap your mind around like what Chagas can look like and what we see on a frequent basis. Okay, and this is what we as veterinarians do at our CE. So we learn something and then we get some case studies, so it'll stick in our brain. Okay, so Remy, real briefly, 9-year-old lab down the road, about 30 miles away, presented at the ER for diarrhea. Okay, the vet did a great exam. Kudos to them. They detected an arrhythmia. We were talking earlier about a scolting. And when we listen with our stethoscope, we could have an arrhythmia. So the vet heard it, said, hey, this is an irregular heart rate, a little fast. We do have a murmur. I need to check for Chagas disease. Okay. Sent off the blood test, came to us a couple of days later because they heard about Chagas and they came right over to us, which I think was pretty cool because the IFA came back negative. So we ran kind of in dual and tandem. We ran the ELISA. We actually got that back quicker, and so it came back positive. So again, I'm running a test that's 34% sensitive, it's negative. I'm running a test that's 90% sensitive, it's positive. Which one am I going to believe? Okay, well, of course I'm going to believe the better test, right? Plus, ELISAs don't have false positives, so we know that the dog has Chagas. Okay, but this is real life stuff. Okay, we get discrepant results with some frequency. Okay, we need to know how to navigate that. So they went ahead while they were there, did radiographs, and you're just gonna have to trust me on this one. This heart's big, okay? The windpipe's coming in here, it's being pushed up or towards the spine, or what we call dorsal displacement, because this left atrium's big. We're not in heart failure, we just got a big heart, okay? Same on this side. Can you appreciate how the right lung right here, there's a lot more right lung than there is left lung, okay? It's because this left atrium, left ventricle are enlarged, okay? Lungs look pretty decent. 9-year-old dog, they look a little white and scratchy in there, but that's normal. We did an echo, which I'm going to show you here. Actually, we'll go to that in a minute. We did an echo, enlargement of the heart, poor function. We did a Holter monitor, which I'll show you. We had some premature atrial contractions, so premature contractions, but up top in this big dilated left atrium. That's from inflammation and maybe some distension. It's not quite big enough to cause premature contractions just because of stretch, so probably inflammation, infection. And we also had another arrhythmia called a sinus arrhythmia, no big deal. Chagas PCR was negative. I think we did that because we thought maybe Remy was in the acute phase and I didn't want to miss it. Okay, so Remy's in the chronic phase. Okay, so this is the cool part. Don't mind all these numbers. This is for our veterinary staff here, okay? We got a big heart, okay? I'm going to play this for you and you can see this. And if you've ever seen an echo, this is the view that we use. And once it stops, I'll show you. So this is the left atrium right here. And this is the left ventricle right here. Both are very dilated. This is the mitral valve coming in here. So blood is flowing from the right to the left. I'm going to play it one more time or a couple more times. And I want you to watch the walls of the ventricle. Okay, we have the septum here and the left ventricle here. I want you to watch on how much it doesn't contract. Okay, we should normally have at least a 20% contraction rate. And his was at about 15 or 12%, 12 to 15%. So you can see there's not much movement here. It's just kind of bobbing here, okay? This is what we call poor systolic function, or this is heart failure. I mean, this dog cannot pump blood out of here because of its infection right now, okay? So that's real important. So this is our Holter report. This is what it looks like. I know it's busy. It's probably a little light. I drew a little arrow here to show you a premature beat that came in. Okay, premature atrial contraction. This is abnormal. This is for 24 hours. So we've got like 120,000 beats. The software goes through, scans it. We go through and pick kind of highlights and look and make sure that it's doing its thing. And then we can kind of better assess this patient. Okay, so we've got a big dilated heart, poor systolic function, and we also have premature contractions in the heart. This is what Chagas does, guys. I put this case in here because Remy encompassed everything that they could get, okay? This is also important. Heart rate of 33 at 10:20 in the morning. That's a low heart rate, okay? Heart rates are generally 60 and below are considered bradycardia or low. But Holter monitors, they can go safely down to 50, just chilling, at home, relaxing. But a 33 is really, really low. And that's because of what we talked about earlier with Chagas going into those neurological areas and knocking those out. So in this case, Remy, Chagas has knocked out the accelerator in the heart, what we call the sympathetic nervous system. It's knocked that out temporarily. So all we have is this overexpression of this parasympathetic, which is this really, really, really slow heart rate, okay? So Remy also, in addition to getting amiodarone and propranolol, we also started regular heart disease drugs, okay? Why? Well, the heart's sick, regardless if it's Chagas, from inflammation, or if it's from a bad mitral valve, or if it's just from a genetic heart disease, Remy needs support, okay? The cool thing is now is that Remy has been on all these meds long enough that we're off of these, okay? We've been in treatment 6 months, so now we're just on the amiodarone and itraconazole. But some of your dogs might have been on this. I mean, Vetmedin is a cornerstone of heart therapy now, and it has drastically helped dogs out across the world. This is tadalafil, which is Cialis, and it's not because Remy needs help in the bedroom. This is because Remy has pulmonary hypertension, which is just a sequela of the infection. Okay, it's just a poor functioning heart. Things are going to back up into the lungs, and he needs a little bit of relief there. Okay. Within 24 hours of starting all these drugs, Remy was $1 million. I called him the next day and he's like, oh my gosh, I don't know what you did, but Remy is running top speed in the yard now. And I'm like going, oh my God, I hope this dog doesn't die from arrhythmia. But, the point is that the dog's doing better dramatically once we start the appropriate drugs to help this dog's heart function better. Okay. And then we did our little 28-day recheck and things looked great on the liver. The itraconazole level was normal and our EKG was normal. So all those premature contractions that we saw in the atria were all normal. So the expectation is that Remy will continue to improve. And at a year, we're going to re-Holter, re-echo, and we're going to see kind of what's changed. Okay. Most of these dogs, really all of these dogs will have better systolic function on the left side. Most will decrease in their size of the heart. So just because your dog has an awful echo and x-ray, it doesn't mean we're going to stay that way when it comes to Chagas. All right, so this is Princeton. Princeton is a very interesting case, but he was the #1 Frenchie in the entire country. Okay, he was an incredible dog, really relaxed, and no matter what your thoughts are on Frenchies, he was pretty cool. He came in because other pack mates had Chagas disease. So we tested him. He was negative. But then something weird happened. Okay. 8 weeks later, so a couple months after we had initially tested him, he started having full-blown seizures. He had 4 of them. Okay. And 9-year-old Frenchie seizures, we immediately go to the worst places and go, oh my gosh, this dog has a brain tumor. But we didn't immediately go there. We kind of started sifting through some things. So we did a full blood work, and we found that he had a high white cell count. That's what this neutrophilia is. We screened for other diseases. I don't just think about Chagas or treat Chagas. Okay, we look for things like Toxoplasma neospora. These are like other protozoal organisms similar to T. cruzi that go to the brain in dogs frequently. The only abnormalities were that we had a positive Chagas titer, okay, and a high white cell count. That's it. They went ahead and went to the neurologist once we had this information, and they went ahead and had him scanned, okay, just in case he has Chagas. And oh, by the way, it's a brain tumor. Okay, so we're just trying to be thorough here. So they went ahead and got an MRI, and I'll show you that here in a second. But they found a collection of fluid in the parenchymal margin. So in the parenchyma of the brain, which is the meat of the brain, there was a collection of fluid in there that they couldn't explain. Now, I hope this shows up okay on the TV. I don't know how big it is, okay? But here's Princeton's itty bitty brain. So remember, Frenchies have a big head, but a tiny little brain. And if you've been around them, you'll be like, yeah, that's true. So we've got this little bitty brain here, right here with 158, this black circle is a hole in the brain. That's the fluid accumulation. This little crosshairs right here, this little circle is a hole in the brain, okay? I'll read this off to you. It's just a big bunch of gibberish that says basically that little hole in the brain is due most likely to a necrotizing encephalitis. What does that mean in English? It means that his brain died from inflammation. Chagas literally knocked a hole in this guy's brain. This was why he was getting seizures. So it wasn't a tumor, okay? It was just strictly Chagas disease that went to his brain at the age of 9. And being the #1 dog in the country, he's pretty well taken care of, okay? So it's not like he's loaded with intestinal parasites. He's eating a bad food and stays outside all day. I mean, this guy is pampered. So, my point is, any dog can get Chagas. And number 2, it doesn't always have to go to the heart. Remember, it goes to all tissue, including the brain. Okay. So we started Princeton on anticonvulsant. That's what this onisimide is. We started him up on treatment. Princeton cleared within 6 months. This is also an exception. So normally I said we treat for a year, right? In neurological cases, most of those dogs are in the acute phase. So we can treat much, much less. Okay. So this dog, within 6 months, his antibodies zeroed out. So we used that to kind of watch things. And once he was zeroed out, we were like, sweet. He did have to stay on anti-seizure medication or anti-epileptics the rest of his life. Okay. And why? Because he had a hole in his brain. Okay. That's why. But not because he had an active infection, but because, it did permanent damage to the tissue. All right. And I think this is the last one before we get a question and answer. This is Bella. Bella presented for blindness in one eye. Actually, no, she had blindness in both eyes. That's right. Just kind of important anecdotally, 2 months before we had diarrhea and temperature, fever, and then resolved with antibiotics in about 4 or 5 days. Okay. We think that's when Bella caught Chagas disease and it presented as GI, right? She eats the bug, gets the parasite, the body tries to get rid of it by causing diarrhea, responds to some antibiotics because the bacteria got screwed up in the gut, and then everything's quiet until it isn't 8 weeks later when we blow out with blindness. Okay. So non-visual, we had this really, really red eye. It's really injected. We call this an aqueous flare. It's just a descriptive term that we use when we're looking in the eye when we have inflammation. Okay. The right side of the eye, the right eye had increased pressure. So this dog was diagnosed with glaucoma and uveitis. Okay. Uveitis is just inflammation in that eyeball. Okay. The left side only had uveitis. We had normal pressures, and that's what IOP means, intraocular pressure. So that's whenever we take that little machine and we tap it. It's called a tonometer, and it gives us a readout to see if there's any inflammation. She was also peeing out protein, and this reminds me to tell you guys that anytime your dog has protein in its urine, that is a possible symptom of Chagas disease. The proteinuria is just happens with any inflammation, but again, in our region in Texas, man, super common cause of proteinuria or protein in urine. So we did, anytime we have uveitis, not glaucoma, but uveitis, we do what we call an infectious disease panel. So we look for common things. Okay, you'll see heartworm on there. Okay, heartworm disease can cause uveitis. We get our tick screens on there. Okay, Rocky Mountain spotted fever, fungal, Bartonella. These are all vector-borne diseases, right? Except for fungal, that's not a vector-borne disease. Everything was negative except, yep, Chagas disease. And we had a whopping titer, big time antibody. Okay, big time. So what do? We went ahead and did normal treatment for glaucoma. Okay, we did too many eye drops. Okay, and then we started treating her for Chagas disease. 30 days later, we could see out of the right eye, so the vision came back in the right eye. I'm sorry, it came back in that was her right eye. The other eye that was glaucomatous did improve. We dropped the pressures down to 35, but we were looking for 20 and below. Okay, so all the efforts we were making was not helping enough, and her eye was still real painful. She was still non-visual, so we went ahead and nucleated it or took it off. Okay, and this is our tonopen or tonometer. This is what we use to measure eye pressures with. So there she is. We took her eye out. We went ahead and submitted it for pathology, which we'll look at on the next slide. And she made a full recovery. A year later, she was negative for Chagas disease, and her right eye has not been a problem since. And that was about 3.5 years ago. So she's doing really, really well with one eye, but Chagas can go to the eye as well. Remember, it can go to all tissue. So this is what it looked like. We're going to go back to pathology. I just love it. It really explains a lot of things. So I don't know if you guys have seen too many eyeballs, okay, on pathology, okay, but this is the back of the eye. This purple thing is the optic nerve, okay, so that's going from the retina to gather information, whoop, right into the brain, okay. This purple thing that's in space shouldn't be floating around in space, okay, and you can see if you look really close, you can see a lot of purple junk in here, okay. Remember from the slide in the acute phase of Chagas disease, purple was inflammation. It was bad, right? Heart, you don't want any inflammation in. Eyeball, you definitely don't want any inflammation in. This thing is the retina, and the retina should be way over here, attached to the stroma or the back of the eye where it can work, okay? So this dog got so much inflammation in the retina that it literally popped off and called it a detached retina, right? And it's hanging on by this optic nerve. So it's like a tether. It's just floating around in there. So this dog was never going to be able to see again. Even if we could have gotten those pressures under control, we would have never been visual again because that retina was too far damaged, okay? So Chagas literally knocked out this retina. Remember earlier we said Chagas has an affinity for neurons, so for neurological apparatuses. This is one of those neurological spots or hotbeds in the body. There's a ton of nerve tissue here. So Chagas was like, sweet, I like this, went in there, started wrecking it and causing havoc. So kind of cool. And then of course, all the red floating around in here, the pink rather floating around in here is blood, okay? Because it caused some hemorrhage when that retina popped off. All right, so we're just gonna be wrapping it up here. So just some things you can do so you feel a little bit more in control of the chaos of Chagas disease and ways you can help people and raise awareness. You can submit kissing bugs to the Texas Department of Health. They offer this. And here I sent Jennifer a PDF of everything so she can email you guys if you want it. but you basically click on this link on there on the PDF, and you can download the form. Okay, and you just fill it out, mail your bugs in, and 6 to 8 weeks later, you're going to get a report like this. Okay, the real official CDC stamp on it. Okay, but basically, I highlighted the important things. It identifies the species of kissing bug, so Triatoma grostekeri. And then it says, did this bug that you found have Chagas disease? And they say, yes, positive. And then they go an extra step. They go, did we find human blood in it? That'll freak you out. And then they say, no, of course. No, they didn't. So just make sure when you fill this form out that you put there was human exposure. I mean, obviously you found the bug, right? There was human exposure, but they're trying to find correlations or links between, you know, hey, this dog has Chagas, these bugs have Chagas, does the human have? Okay, but this is something really important. So if somebody thinks that they don't have Chagas, have them go gather a couple of these kissing bugs and send them off. You'll be surprised at how many, right? Greater than 60%, right? So, and this is just our public health hat that we wear as veterinarians. You know, we want to help raise awareness so you guys don't get sick. Hello. So, takeaways for you guys is that, yes, this is a bad disease, but this is a treatable disease, especially if we catch it earlier. Okay, we don't want to wait until we're in full-blown heart failure. Please don't make life harder than it has to be. Okay, get your dogs tested, get your cats tested, test all pets. If you have horses, test your horses. Okay, we see it in horses, and it can be devastating. Anytime anybody tests positive, hold on, let me back up. Anytime a pet tests positive, clients need to get tested. Okay, you guys need to get tested. It's real important that we do our job for public health. You're not going to catch it from your dog or cat, okay? But the kissing bugs in your environment have it clearly. That's how your dog got it. And you are exposed and you're higher risk, okay? So you need to get checked. I don't have that many people that have tested positive, but I've had 7 people in the past 18 years. Okay, it's not many, but I've had 7 people test positive, and they never would have gotten tested unless, you know, their pet would have gotten tested. We had that conversation. So don't go rush out to your primary care tomorrow, but just know, hey, I need to be aware of this. Everybody in our practice has been screened. We're all negative so far, but we deal with this every day, and we're dealing with blood and bodily fluids, and you know, we take extra precautions, okay, especially if I don't know the status of a Chagas dog. Those are the ones we worry about. And then the last thing is you have control over reinfection. So get out there, spray your environment, make sure your dogs are on these flea and tick preventions to help prevent transmission of Chagas. So that's it for me. Here's an email. This is a Vita Pharmacal, just real quick, is a company that we started because of Chagas disease. We made this chief purpose is to get the drug approved and get it out to people. Okay. And now we've added things like diagnosis. We're also treating and diagnosing another disease over in Europe and South America that's a cousin to Chagas disease. It's kind of expanded, but it originally started because somebody needed to do something about this. These are my dogs. The pug is 14 now. That's Buddha. He's tethered because he has an issue. We adopted him, and he did not know how to potty train 10 years ago. So he lives life on a tether, but he's very happy. All 3 of these guys have Chagas disease. They're done with their treatment now, and everybody is normal. Thank God, because the golden on the left, she almost died during her spay procedure about a year and a half ago, and she went into VTAC, and it's my son's dog. Not a good way to diagnose Chagas disease. The weird thing was I'd already tested her that year about 10 months earlier, and she was negative. So I learned an important lesson there. Okay, but she's doing great now. Her Holter is perfectly normal now. She has no arrhythmias after treatment. And thank God she didn't die. That would have been a bad one. But if you have any questions, please feel free to email me. I'm happy to answer any questions you guys have. So I will stop talking now. And if anybody has any questions, type it in the chat, or you can just talk and I can hear you. Okay, just make sure you take off of mute.
Okay, there you should be able to hear us. Okay, does anybody have any questions? Yeah, Michelle, go ahead and come up to where Dr. Madigan can hear you and see you.
I know you're shocked to have a question, right? Okay, am I in the right place?
Nope, over that way.
How about if I sit right here?
There you go. That'll
Okay.
work.
Okay. All right, I guess, am I looking at it now?
Yeah.
Okay,
He can see
so, if you have, I have a dog in the house that is Chagas positive. And I had the other two in the house tested, but they had the IFA test done. They both came back negative on the IFA. Should I go ahead and have the ELISA test done on them? Or, I don't know, what would you tell someone that asked you that? Your little screening, test, that's his, right?
If it came from Vita
I think
Pharmacal,
so.
yeah.
Vita Pharmacals who has the little screening test, right?
Yeah, that's
Okay.
correct. Yeah.
Okay.
Was that test positive or was that
Well,
negative?
so yeah, my vet has been using that, and my dog that is positive, she came back as a 6 on that. And we sent her off, her IFA came back positive. So I said, okay, we need to test the other 2, right? That's what he said to do. My lab came back at a 6, the same as her. So we thought maybe, maybe not. My other one, my little mix, came back at a 10 on the screening. And his IFA was negative. Neither of them have any symptoms. So I didn't do anything more. The ELISA, the vet said, will do it at the end of the positive dog's 1 year, that we would do that blood test instead of the IFA. But he didn't say anything about doing the ELISA for the 2 that came back negative.
Okay. And we get this question a lot, because the IFA is widely known because it's what we've been using for 30 years, to test for Chagas. But now that we know what we know, right? The ELISA is definitely a better test, like we had talked about, and that in-house test. So for those of you that don't know, we developed this test and we had to do a field study. So we had to get multiple locations and just kind of run it through and see. But it's based on the ELISA format. So it also has 93% sensitivity, so a little bit better than the ELISA. So when I have a dog, so with discrepant results, basically the in-house was positive, especially a 10, and these are intensity scales. They don't mean anything other than there's a lot of antibody floating around. Okay, it's just intensity. So like a 6 is, right down the middle. It's 1 to 10. And 1 is like, I can't even see that line. Okay. Like our younger techs have to read it because my eyes roll. But like a 10, I mean, you don't need to be wearing your glasses for that. You can see that across the room. So that's super hot positive. The IFA requires, so when you compare it to the ELISA, the IFA requires 3 times more antibody to test positive. Okay. So the ELISA is a third of that. It can detect it. Now the in-house test is 5 times as much to test positive on an ELISA, on an IFA. Sorry. So a fifth. It can detect a fifth the antibody levels as the IFA can. Okay, so very early detection. We did that on purpose because we've got to be catching these guys sooner. So like this dog right here, this golden retriever who's walking around the back trying to get attention from me, the one that almost died a year and a half ago, her test was positive on the ELISA, positive on her in-house test, negative on the IFA, and she almost died. So you can see how antibody levels don't correlate with intensity of disease, right? So yeah, I think you know where I'm going with this. I would definitely ELISA test those guys, only because like I trust that in-house test, but because it's not USDA approved yet, we're going through that process. We need to use another test to confirm it. Okay, and I think that's where that ELISA comes in. Okay, the other thing is that when you talk about testing, the IFA and the ELISA for that matter, or even this in-house test, if a dog has Chagas disease, it's going to eventually test positive. Number one, you have to have the right antibodies. And what I mean by that is, so let's say our in-house test for antibody A. Well, what if the dog makes antibody B? Okay, well, it's going to miss it on that test. And so it may pick up on another one. Okay, if that makes sense, that tests for B. The other thing is antibody level. So I have to have enough of what I can detect to where I can actually find it, right? And that's where the in-house test outperforms everybody, is it doesn't need much, okay, but it needs specific antibodies. So it's still going to miss some occasionally. So I would say, do the ELISA on those guys. At the end of treatment, we're actually going to do a PCR. Okay. We're not going to do that ELISA again because those antibodies can stick around for the life of the dog after treatment. Like I had a dog today that's 7 years old that came in with Chagas disease. Well, that titer IFA was off the charts, greater than 1280. The lab gave up. Yep, so many of them.
Yeah.
So that'd be like a 10, right, on the in-house test. So that dog, I know at age 7, there's no way those antibodies are going to go away by the time the dog dies. Even if it lives to 16, it's still going to have antibodies because there's so much of it. It's just going to stick around. So to find out if we cure the dog, so your dogs, for instance, at the end of the year, you're going to stop the medicine. You're going to wait a month, and then we're going to do PCR. Okay, we're going to look for that parasite to reactivate. All right. So that's just going forward, just to kind of help your vet, as we go forward. And I'm happy to send them like the protocol. I can email. So if you email this, or you can give him this email, and if they want to know, I'll be happy to send them that protocol. Okay.
Okay, thank you.
You're welcome.
Any other questions?
You said you see it in horses too. Same symptoms? I mean, or what are you seeing most frequently in horses?
Oh, full disclaimer, I'm not a large animal vet. Okay. So this is just from other vets I've talked to. Okay. But two big things, just like Princeton and Remy, heart failure and neurological. A&M did a paper probably 9 or 10 years ago. It was a horse that had Chagas in its spinal cord. So it presented for symptoms, neurological symptoms. So walking funny, down, that kind of thing. And in fact, they thought it was another protozoal organism. If anybody are horse owners, EPM, real common, spread by possums, another parasite. They thought it was that. It was negative, Chagas in the spine. So it can definitely go into the spinal system or the CNS. And then the other is I have had multiple horses from internists share with me that have had cardiomyopathy, so heart disease, and that totally made them think, oh gosh, I need to be screening these horses for Chagas disease, and it makes sense. I mean, these kissing bugs, any mammal will do, and they're out there in a barn. I can't think of a worse place for Chagas. Makes you want to have a bunch of chickens running around eating those bugs everywhere. But those are the two common presentations. Me personally, and nobody's looked at this before, but I wonder how many GI cases, how many colic cases in horses we have that are caused from kissing bug ingestion. I mean, it's got to be profound, but I don't know. Nobody's looked at that. Okay, so that's a good one though. That's a great question.
Okay, any other questions? I know Dr. Madigan said one presentation he did not too long ago, questions went on for another 45 minutes. So
I know you guys are easy. You must be full. You're full. I get it.
Informative what he told us.
So he has planned for questions. So Renee, you come up and ask the question.
I just want to know if any government agency or anything, is anybody doing any research to help get rid of Chagas bugs?
Did you hear the question?
I did. Yeah. I don't think so. I'm thinking, so we're part of the Chagas task force that the CDC created about 9 years ago in Texas. And we've got everybody on that, entomologists, the bug guys, healthcare professionals, veterinarians, state veterinarians, state health people. But I don't think it's not like in other countries. So like, for instance, Bolivia, they're the #1 country for Chagas in humans. They were in the double digits. It was ridiculous. And they thought it was because of, kissing bugs in the environments, which is true, but they thought it was, they're living in filth and, big holes and cracks in the places that they live, and the bugs would burrow in there and then take blood meals at night and then go scurry off into the cracks at night or in the morning. So they made a very concerted effort to spray, and like big time, and they actually lowered their numbers and their prevalence rate in humans way down. I still think it's like 3.5% of humans have it, and compare that to like Mexico, like 1% of Mexicans have it, that's a lot of people. But, spraying efforts by the government in those countries were effective. Okay. We don't have anything like that here. In fact, it's not even reportable in the US anymore. It used to be reportable in Texas. Now they don't want to do any more paperwork. So they made it not reportable. California's trying to get it reportable over there, again, to try to increase awareness. But when it's not reportable, there's no push from any government agency to get after it. So it unfortunately just falls on us, But man, you want to talk about a cluster on the human side. The biggest number of Chagas patients are seen on the blood donor side and also organ transplant. So finally in 2007, they made it mandatory to test the blood supply. And they also made it mandatory later. I don't know the exact dates. I want to say maybe 2011, 2012, they made it mandatory to test organs before you get an organ. You have to make sure you're Chagas negative, okay? Because people are dropping like flies. They were either putting in infected tissue into people and they weren't testing for it, like even infected blood products prior to 2007. Or the people had Chagas disease and they would immunosuppress them so they wouldn't reject the new organ and they'd end up killing them. Okay, so pretty heavy duty stuff, but they got it well worked out now. And one of my colleagues is in New York City at Mount Sinai, and he is in charge of all this, and they test quite a few of folks every day for Chagas disease because of their organ transplant programs that they have there. So just on the human side, if you're interested, a little side note, blood banks for dogs do not test for Chagas disease. They'll test for everything else, but they don't test for Chagas. The only blood products interaction I've had where they did test for Chagas was at LSU, and that was in-house. So for their in-house dog program, they actually did check for it. It's like, brilliant. Good job, guys. But the major suppliers of blood products for veterinarians, they don't check for it. And there are ones in Florida, ones in California. So they've got Chagas, but they're just not looking for it, unfortunately.
Is there any work on doing some kind of a preventative drug like heartworm pill? Is anything for Chagas?
Yeah, that's a great question. So we're actually, that's our next project that we're working on right now, is we're working on a preventative. Unfortunately, vaccines don't, well, right now the vaccines don't work, and they've tried it. They tried it in dogs. They were only able to get 50% of them to not die, okay, after they exposed them to it, but they still got the disease, so it wasn't preventing infection at all. And a lot of that goes back to what we were talking about earlier about antibodies that the dog makes, how that's actually what we call arrhythmogenic. So those antibodies cause problems, and those antibodies are not protective. I mean, dogs that have the highest antibodies will still allow infection. So in my opinion, and this might change over time, but right now in 2024, I don't think a vaccine is going to work to help prevent disease. So the route we've taken is a slow release, kind of like with heartworm prevention. Okay, so how does heartworm prevention work? Well, you give a dose of drug every month, or if you inject it, it's slowly released every day to help kill babies as they come through. We're taking the same approach there. So a slow release formulation and an injectable version that will kill parasite at every stage. So, if they get bit, it's going to be concentrated in the skin. It's going to take it out there in the bloodstream and the heart tissue. And then if they eat it, it's going to be in the gut. It's going to be in the bloodstream, and then again, target tissue. So we're trying at a lower level, okay, of these drugs to slowly release them to help prevent it, okay? And you have to give it every day. You could probably get away with it every week, but nobody's going to remember that. So that's why we're going with the injectable route. Plus, the injections for prevention will be cheaper than if we were doing it orally every day or every week. So that's what I'm going to recommend, at some point. And we should be there. I mean, by the end of the year, I think the prototype's going to be done in April. And then we're going to start, trying it out to see if we can get some prevention out of it. So, but that's still, you're probably 2 years out before we can help prevent it in these dogs. Because once we finish treatment, like my dogs right here, I mean, they're off drugs now. So they're fair game right now to kissing bugs. If they eat another one, they could get it again. And so the reinfection rates are actually very low. I think they're less than about 5% in dogs. And mainly because, like, in my environment here, like, none of my animals have Chagas. I have a scorched earth policy when it comes to bugs. Okay, there's not a kissing bug alive out there. But they can still eat them. A dead kissing bug's still infectious, right? But I know I've done everything I can, and they're going to be really hard pressed to get infected. Okay, at least in my backyard.
Anything else?
Those are all good questions. Thank you guys.
All right.
Yeah, I was trying to figure out how to ask this, but if we give like fresh frozen plasma to a newborn puppy, could it be transferred through that if it's in blood? Yeah, so from
Yeah.
dog. Okay,
Yeah, unfortunately, it sure is. And
okay,
again, I don't think they're screening for it. So
no, that's what made me think about it when you said that.
yeah, I know it's a problem. I know it is hard. Like for those of you non-veterinarians, you know, it's hard to change our mind about anything. We're pretty stubborn, but we're having to change the paradigm of Chagas disease in America. Like every vet school still teaches it the way it was taught 50 years ago. You know, do you live in a thatched hut? If you do, you need to worry about Chagas. If you don't need to worry about that. That is not true. Your dogs are dirty and they eat everything. And they eat things we don't want to discuss because we all just ate. So it's a different environment. And I am blown away at how much stuff dogs put in their mouths all day. So they do live in a thatched hut. Even worse than that, you know, they're in the pigsty. So I think until the vet schools change, and we are working on that. Okay, we are going all the way to the top so we can change the curricula. But it's still being taught today as I was taught 24 years ago in parasitology, and that's why I fell asleep. It was irrelevant. And they were like, "You're not going to see this here. It's in Mexico on down." Okay, great. Until I saw it, right? So it's don't be mad at your vets, right? It's we got to go to the source here. So that's what we're trying to do, and you know, this is going to unfold over many years. But you guys, by asking your veterinarians, hey, I want you to test for this. It's going to help them too because they're going to learn, especially if they're positive. They're like, oh my gosh, maybe I do need to start looking for this. Because as a veterinarian, once you start looking for it, you kind of put the pieces of the puzzle together. You know, we're pretty good problem solvers, I think. And we, you know, we start to go, okay, I need to be looking here. And I think, well, I can't explain this. Oh, maybe Chagas could explain it, you know. So we're going to get there slowly but surely.
Well, thank you.
Yeah, thank you guys for having me. Hope dinner was good, and please email me if you have any further questions. I'll be happy to reach out to your vet for you or anything like that. Okay.
Appreciate it.
Thank you. And Dr. Madigan, I'm going to have to get in touch with you because my husband went to his internal medicine doctor last week and took that letter that you gave us. His doctor refused to order the test, saying that Chagas is not in the United States.
Wow. Yeah. So
my husband said he had a dog die in his arms, you know, from it. He said, so don't tell me it's not here in the US. And he says, well, I guess you'll have to find a veterinarian to test you.
Wow, man. Wow. And people do get it. Your husband has a lot of patience. People do get it. I mean, they do get it. And I don't want to scare you, but I've had patients die from it. Okay. I had a 26-year-old die from it earlier last year. And it was awful. He went in and had flu-like symptoms and he died in the hospital. They couldn't save him. I mean, this really does happen. And we see, I think San Antonio, the Department of Health told me they see 30 to 40 cases a year. I mean, those are the ones that are actually getting reported to them because they donated blood or, you know, whatever. Like the military screens all their intake folks, their 18-year-olds when they come into boot camp because of their dogs. But the internists know they're, you know, and you know, your husband can't tell the guy, you know, because he's so closed off, but he can't say, hey, you know, my dog wasn't in Mexico. You know, it's been in my backyard. We have Chagas. You know, it's not a big stretch, you know. So, and that letter's from the Department of Health too, man. I have found that there's a better support. There is better support from your family practitioners than there is the specialists. Okay.
Okay.
I've yet to meet a cardiologist that was receptive. Okay. A human cardiologist. So, you know, keep that in mind when you're trying to get tested. You may just have to lower it down a little bit or go to urgent care and say, believe me, here's the test code, you know. So, but thank you guys, and y'all have a great, okay.
Thank you for your time.
Thank you.
Okay. Thanks guys. Bye-bye.
Bye-bye.